Good morning and welcome. This is the International Center for Journalists webinar. This is part of our initiative, the Global Health Crisis Reporting Initiative, which we have set up to provide resources to support journalists covering COVID-19, which is pretty much every journalist right now. I'm Sharon Moshavi. I'm Senior Vice President at ICFJ, the International Center for Journalists. And many of you here today are part of our forum's closed discussion group, which we formed not even 2 weeks ago. And we now have more than 2,200 members, 2,200 journalists from around the globe sharing information with one another. It's pretty impressive. If you'd like to join the forum but haven't, please check it out on Facebook, and hopefully we'll put a link to the forum up here in Zoom. Thanks again for joining us. I know everybody is very busy, so let's get started here. And we're going to be talking a lot today about what the WHO has called an infodemic surrounding the coronavirus pandemic. There is so much misinformation, accidental information, and active disinformation swirling around. And it matters, right? Facts matter. Falsehoods right now can get and are getting people killed. So we're here to talk today about the misinformation narrative that's spreading around COVID-19, how it started in Asia, what the narratives coming out of there are and have been, and in particular, how journalists and the medical community are working together to battle those narratives. We've got two fantastic guests joining us today. We've got from Delhi, Syed Nazakat. He's an award-winning Indian journalist and media entrepreneur. He pioneered Asia's first data-driven health news platform called Health Analytics Asia. And it's great, it's building collaboration between journalists, doctors, and technologists. He's actually, as he says, brought doctors into the newsroom. And one of the doctors working with Health Analytics Asia also joins us today. He is Dr. Ahmad Firdaus. He is a medical doctor from Malaysia and a public health medical officer at the Ministry of Health. He's also the founder of Medical Mythbusters Malaysia, a consortium of medical professionals dedicated to countering false health narratives. The group has more than 50 doctors, pharmacists, and paramedics, and a very large social media following. So thank you both for joining us. I really appreciate you being here today. And you both have been following this outbreak from the very beginning, back in December. Syed, I know you were covering this. Can you tell us a little bit about how you started covering this and what you were starting to see in terms of the story?
Yeah, thank you so much. Really pleasure, Sharon, joining this special webinar with you. And I think what was happening when the first case came from China, it was by just coincidence that I was speaking to one of the Chinese journalists, and she was saying something is going wrong in China and we don't know what's happening. And it was very early days when the numbers were just, I think, in a couple of dozens and then hundreds. And I think it was a quick chat with her. And then after that meeting was over, I stayed in touch with her for the next couple of days. And then suddenly we realized that the story is becoming bigger and bigger and bigger. And within 1 or 2 weeks, it was very clear that something big is happening in China. And I think that was the first, you can say, sense of the situation we had. And then we started seeing what is China publishing and release, or what are they releasing officially, the numbers and data. And that was, I can think it was the first week of January when we started actually reporting situation in China.
And what were you seeing immediately in terms of misinformation or were you seeing active disinformation at that point?
Yeah, so what we did essentially was that we kept an eye with that Chinese colleague, with us actually, we started to have, started closely monitoring WeChat essentially. Because as you know, the WeChat like WhatsApp and Facebook has different dozens and thousands of accounts, family accounts, friends accounts, and these are all closed groups. So if you're not part of those groups, or if you don't know the language Mandarin, you will not understand what was happening. So with that colleague with us, we were able actually to figure out at least the first conversation which was happening in different chat groups in China, which was essentially a lot of panic, a lot of fear, and population was completely clueless because China was not releasing official figures. As we later knew that the first death also happened of a doctor who was a whistleblower, and he was arrested and detained and then released and actually forced to sign a paper that he will not disclose any numbers. I think that first 1 month, actually, if you look at it from mid-December till mid-January, was really a most critical phase of this pandemic. And I'm really pretty sure when we examine the situation now, we think if it was better held by China during that time, we would have really saved a lot of lives actually. It happened because there was no official information, and then when with most misinformation, you can say tides around the world, when there's no official clarifications, misinformation and panic actually suppressed, and that's what exactly happened with China as well, and with other places as well after that.
And what were you seeing in Malaysia back in December and January too? When did this come to your attention, and when did you start working on this, both as a misinformation buster and as a doctor?
Well, for Malaysians, we're sort of like quite protected from all these other news and sorts. So our first experience with COVID-19 or novel coronavirus, as it was known back then, was when it arrived in Singapore. So at that time, there was news flowing in from China about this new virus that can cause death and everything. There was the main focus of the misinformation then was about how it spread and the panic it caused. There were videos of people just falling on the street out of nowhere. So at that point during January and February, every single person that collapsed, even due to a heart attack, it will be attributed to COVID-19. And also there was a strong xenophobia back then. Even though Malaysia is a multiracial country, there was a strong phobia towards Chinese people from China. So yeah, back then it was during the Chinese New Year, so people were the Malaysian public was quite hesitant on accepting Chinese tourists to Malaysia. So that's the main issue initially.
So what are you both seeing now? And Syed, what's the view? India is under a 21-day lockdown for now. And as we were talking about before, you know, rumor conspiracy theories spread very quickly. What are you seeing now? And tell us a bit about how you're working with doctors and how that's helping you to verify information and debunk misinformation.
Yeah, no, what we are seeing actually in India and I think elsewhere as well is really a massive, unprecedented wave of misinformation. I think we have been training journalists in India as a part of a major network supported by the Google. And in the last 2 years, we've trained around 16,000 editors, journalists and all. And we have been seeing misinformation in India. But the amount and the scale of the misinformation right now is just unprecedented actually in so many different ways. Like almost every day, there are thousands and thousands of WhatsApp chats, WhatsApp videos, Facebook videos, YouTube videos. And these are circulating unstoppable actually. They're moving from one group to another group and nobody is able actually to trace and stop this misinformation. And as we are seeing actually, because of this, you can say a wave of misinformation and myths and conspiracy theories or bogus treatments, people are actually dying. And look at Iran for that matter. Almost 200 people died after consuming alcohol because they believed on rumors that alcohol can treat or cure this disease. In India, one of the first cases of casualties of COVID-19 was a man committing suicide because he was watching a number of social media sites and he believed that he's suffering from the COVID-19 without going through tests, and he wanted to protect his family, and then he just killed himself. So we're having really, I think we had one death yesterday as well, where a person committed suicide because he wanted to protect others. There are a lot of rumors about it, and really at unprecedented scale. That means one video, which is absolutely nothing to do with the current situation, like old videos of different places in the world are coming together and getting circulated as if it's happening right now in some part of India, Pakistan, Bangladesh, or Malaysia or Singapore actually. And I think the way I'm looking at the situation is that I'm certainly looking at a way that this COVID-19 will certainly change our way how we look at science and medicine and health forever. I think there'll be more awareness that we really, really need to think about how we communicate better, how we disclose numbers better, how we empower people in a crisis situation. Because what we are seeing across the board, not in one or two countries, is that somehow, except I think one or two countries, the governments are not coming clear what's happening, to be honest. That creates a lot of fear, a lot of distress, I think I can see a huge population suffering from different mental situations because they're locked down in their homes. They don't know what's going to happen next. Some have relatives somewhere stranded. Some have kids somewhere else. So it's a very different situation we're all facing in Asia and the rest of the world.
So what do journalists do? Do about this? As a journalist now covering COVID-19, which, as I said, is pretty much every journalist at this point. How do you combat those narratives? What can you do against this fire hose? And talk a little bit about your experience, how you're working with doctors, and does that help? And is that something others can try to emulate?
Yeah, I think the journalists certainly have a critical job here. And that's why one of the reasons that a number of countries, actually journalists are allowed to go out of lockdown situation along with the doctors, that they can report and write and cover situations. I think our job really is critical here, that we really need to be very careful what we write, how do we describe situations? Do we have a correct data? Are we meeting people, right people? Are we interviewing right people? Because everybody seems to have become expert in COVID-19. So we need to really make sure whether we are interviewing right people. And what we did at Health Analytics Asia was a very unique approach to storytelling when it comes to health, medicine, and misinformation. I think our journey started some like 3-4 years back when we invited some 20 doctors and 20 journalists in one part of India to do a kind of an experiment, a hackathon. How can we make sense of health data to empower people? And that relationship was going in the last 2-3 years, and we did collaboration with doctors in almost 11 Asian countries. But last year, we thought, like, let's take it a step further and do a little bit, you can say, at a deeper level collaboration. So we thought, like, and then it was also the time around when we realized actually there was a lot of misinformation happening all about us, though majority of it was seen about politics and political situations. There were a lot of misinformation about health, which was not really catered by the fact-checking organizations. Almost 25 to 35% misinformation in India, at least which we researched, was essentially about medicine, cancer, vaccination, public health, and all. So we thought, like, we as a journalist, we don't have a capacity to understand a lot of subjects related to medicine. We need a support of doctors, public health specialists. So we put an open call, and we asked doctors all across Asia, would you like to join this collaborative effort in which you become part of us and help us in tracking and verifying numbers, figures, and situations? And I think within a month or 2 months, we got a remarkable response. I think some 18, 19 senior doctors all across Asia signed up the form, and they said, we want to help you guys in this situation, and we also want to learn about it. And then out of those 85 people, actually doctors, we selected around 21 doctors so far from 13 countries. And these include oncologists, public health specialists, virologists, epidemiologists, endocrinologists. All these doctors actually are working with us on day-to-day basis in a messaging group. So whenever we see some misinformation, we share it with them and take their feedback. And then we also encourage them, because they're all specialists in their own different areas, to share their opinions. For example, diabetes. There were a lot of myth about and rumors about diabetic patients in COVID-19. And as you know, the diabetes is one of the biggest diseases in Asia and India particularly. And that endocrinologist actually wrote a beautiful and insightful couple of opinion pieces about how the people who are suffering from diabetes can protect themselves during COVID and how they should not believe a couple of rumors and all. So I found essentially this collaboration was really unprecedented in a way. And the situation gave us also a chance to explore and take it to a next level, that in a way that we have doctors from Nepal, Bangladesh with us, Sri Lanka, Malaysia, Australia, India. So all these doctors also helped us at one-to-one level to also understand the magnitude of the problem. Some of them are working, like my friend Ahmad Firdaus, for example, is a part of public health ministry in Malaysia. So he knows how the situation is being dealt by the government. So he has some insight as well there, which could be useful to other countries, that you can approach and adopt this approach while dealing with the misinformation. So I think this whole collaboration really flourished, and really, I must say one thing: the doctors were really, despite of their busy schedules back home and in hospitals and all, they really came forward and then rose to the occasion to share the really insightful understanding of the situation, which I think has really prevented thousands of videos and WhatsApp messages from circulating, because we are debunking them almost on a daily basis.
Dr. Firdaus, you're part of this network of doctors that is working with Health Analytics Asia. You've been interested in debunking health misinformation for a number of years now with your own organization. What types of misinformation narratives, this is a question from the audience, are you seeing now? Are you observing? Is it fake cures? Is it false sources? Where are the biggest pain points right now in terms of false narratives?
Well, fake cures is one of them, and then it's just there's this constant source of misinformation that can cause panic. There's always someone saying that you can, if you get too close to someone, which, I mean, for example, symptoms. They have all these weird symptoms that will point you towards having a COVID-19, when in fact that it's not true. So people will have this unnecessary fear, and then people will go unnecessarily to the hospitals or clinic to get treatment, when in fact the best thing to do at the moment is to just stay at home. If you're well, you're healthy, you have no issues, then just stay at home. That's the best thing that we can do. But somehow there's always someone always trying to form back that chain, asking people to go out and do all these things. And don't even talk about the anti-vaxxers. They are asking people to go out and just tell the world that all this COVID-19 is just a hoax. So yeah.
That's very interesting. Can you talk a little bit more about the anti-vaxxers, what that population is like that you've seen in Malaysia, and how they are contributing to misinformation now around COVID-19?
For Medical Mythbusters Malaysia, we are active primarily on Facebook. So we scour around for all this information regarding anti-vaxxers. So we have identified certain strong individuals with a lot of followers, a lot of they have a lot of traction among their followers. So what we do is we identify what they're doing, and then from what they say, we try to debunk whatever misinformation that they're saying. So these groups of anti-vaxxers, they have a very strong following. These followers would follow them blindly. So what they usually say is, one is COVID-19 is a hoax. And then you don't need to get any treatment because you can save yourself by taking all these excess vitamins, megadosing of all these vitamins and stuff. And also saying that COVID-19 is a natural process. So you should not be afraid. You should just go off. If you get the infection, then you will have an immunity towards COVID-19. So these are very dangerous points that they are bringing forward. So we catch those and we repackage it and we convey the proper message forward.
Is it the anti-vaxxers? Is this something that you're seeing? Either you're seeing across Asia? Is this a broader narrative, or that's happening, or are we seeing very country-specific misinformation actors and narratives?
I think it's a broader. I mean, it occurs all around the world. If you see the resources, some are from the United States, some are from Australia, some from China. So I wouldn't say that they are an organized movement, and in the local setting, they are very organized. In an international setting, they might not be as organized, because it's ironic that in one part of the world, such as in Australia, the anti-vaccines there would say that this is part of the Islamic attempt, the vaccination as an Islamic move to make everyone become Muslim. For the ones in Malaysia, they would say that this is the agenda of Christianity, the Jews and everything, to destroy them. So it's quite weird. One is pro-Islam, the other one is anti-Islam. So not really sure about that part.
Syed, what about you? Are you seeing these folks in other parts of Asia as well?
Yeah, I think, as Emma said, actually, I quite agree that, we are seeing vaccine as one of the major source of, you can say, one of the major targets of medical misinformation. Like imagine in India, we have a state called Kerala, which is the most educated state. And a couple of years back, the vaccination stopped in 2 districts of that state because there were rumors on WhatsApp that if you give these vaccines to your kids, they will get infected with something different. And for 2 complete months, the whole vaccination of thousands and thousands of kids stopped because of those WhatsApp rumors. So if I look at actually at the format of the misinformation, how does it actually spread? So what we have seen actually, though the Facebook is certainly a huge carrier of the misinformation and then other platforms, but in case of India, Bangladesh, and Pakistan to some level, we are seeing a lot of things happening on WhatsApp. And the problem with the WhatsApp format is that because you can see something on a Facebook and you can comment on that and say this is fake and this is not true. But the problem is the WhatsApp is a closed group. And in India, we see it as actually another newspaper because every family has a WhatsApp group. And that makes actually the chain to break this misinformation chain very, very difficult. And what we have also seen with the COVID particularly, because it has like affected so many countries at one place, then there are videos which are from Italy, which are from Germany, which are from Spain. Somehow these videos are re-uploaded with different context. Like if there's a doctor sleeping, a video will be the doctor has died. And there will be, it takes really hard to verify that and just say this is not true. And then old statements, which we have seen in the Bill Gates, for example, situation, the old statements of doctors or philanthropists or whatever have been used and kind of out of context to support some conspiracy theories. Because with 3 things we're here, like if you look at the source of misinformation, I think when it started in China, the majority of misinformation was about the origin of the virus. How did it circulate? Was it a CIA doing some special operation in China? Was it a virology lab of China which was making some bomb or something, biological bomb or something? So all those kinds of rumors. But then when it moved out of China and then started infecting other countries, then most of the rumors were actually about how does this virus spread? And then that got really huge, chunk of videos essentially. And it was not really like that became xenophobic. And then those videos became even uploaded on TikTok, which we have not seen earlier actually, at least in this part of the world, that we were seeing TikTok, a lot of humorous stuff, but not misinformation. And I remember just 2-3 days back, the TikTok came with the announcement that they removed a number of videos from the platform because they were giving a completely misleading, false, and even at some instances, completely a bogus treatment. Like say, for example, in India, cow urine is seen as a treatment for everything, even for COVID-19. And there have been a cult of people actually around who have been actually drinking cow urine, saying it will cure us from COVID-19, but absolutely nonsense, to be honest. So even the government of India, by the health minister himself, said people, please don't believe these rumors and these stupid statements. But then imagine in a country, not only in India, but other countries as well, where majority of people actually, the literacy level is extremely low. And then it becomes a really, really serious situation. It's really a life and death situation there.
So Ahmed, what are you seeing in Malaysia? Is WhatsApp also sort of the main spinner or the main platform through which a lot of misinformation is spreading? And on top of that, what formats are you seeing? Is it text? Is it video, either fake or contextual, uncontextualized? Is it memes? Can you talk a little bit about sort of the formats and the platforms?
So our setting is almost the same as in India. Most of the misinformation is spread via WhatsApp. So that part is quite difficult. It's difficult as Syed mentioned earlier. It's very difficult to trace where the origin is. Sometimes the text would be something like, oh, this doctor said this is a cure for COVID-19, blah, 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 blah. And when we check verified whether the doctor is real or not, it turns out it's completely a hoax. So that's one portion that we find it very difficult to manage. But fortunately for Malaysia, we have the MCMC, Multimedia and Communication Commission. They track all this stuff somehow, and they have this Facebook page, or they always send these text messages about identifying which parts, which messages, or which Facebook posts are fake. So that's what keeps everything in check. So even in the news, we have at one point in time we have like daily updates of which news are fake. So one day we have 12 and so on. So that's the good part about Malaysia.
So yeah. So you're actually, so this is coming from the government. The government you're finding to be an actually trustworthy source of information right now?
As of now, that's the best that we have, because they do, I mean, compared to the first half of the year during January, some politicians would say something else. This politician would say something very weird. Some politicians even are outright believing in all of this myths. Eventually, towards the end of January, February, things were more organized. So there was one point of information whereby the Ministry of Health will always have at least 3 press statements, one in the morning, in the afternoon, and around 5 o'clock. So people would have an update of what's going on. So it's very focused. So we'll tell what is the number today, how many deaths, where are these, where are these patients at, and everything. So it somehow creates, I mean, for me, I think the misinformation is there when there is no information. When there's a vacuum, then all these myths, rumors will come. So when there's that one focal point of information, then it becomes more organized. Whether it's true or not, as part of the Ministry of Health, so far it's been a valid information.
So another question, and I've been incorporating questions from folks in the audience as we've been talking, but another question coming in is about what tools you are using to track that information or fake news from social media. Can you give any, Syed in particular, Ahmed, feel free to jump in. Any advice you can give on how people can be doing this?
Yeah. There are really number of tools, to be honest, both for verification of photos. Like, one of the basic tools we use is the Google reverse image search. And if you know that tool, it's just a very easy to learn. You can control almost 50% of the fact checking on the images. Then the index is there, which is TinEye is there. These are very useful tools when you have to look at the images for that matter, because they will help you to figure out if somebody is saying this happened at this place yesterday. The Google reverse image search will help you to figure out whether this picture was uploaded on internet last week, last month, 1 year before. If that is confirmed, so then you can easily say this is not related to this event, it was uploaded a year back. And similarly, Yandex is really a strong tool when it comes to images which are uploaded from Russia, because what's happening is it's a global disease outbreak, and we are seeing pictures all across the world actually mingled up, and people do not know which part of the world this picture is from. Like, we have like hundreds of pictures with us which are from Central Asia, but God knows how they come and they started getting circulated in India on WhatsApp groups. And then for videos, there's InVid is a very strong tool. If you're using that tool is really strong in terms of giving you the date and frame by frame situation of any video which has been altered. And Data Wrapper, which has been developed by the Amnesty International, is also a strong tool to verify videos for that matter. And then there are a lot of tools actually, and which are very essential now, because what we're dealing right now is not really just the tools, to be honest. We're dealing with the pattern, and we have to really be careful about how to deal with this pattern. That's why doctors are very critical in this fact checking. You can do journalistic fact checks with the tools and techniques, but you need doctors on board. You need experts, virologists, epidemiologists on board, because as I said earlier, when it all started, the most of misinformation was related about the source of the virus. Then it became the spread of the virus, how it spreads, and people start getting panic, and a lot of myths about that. Now, right now, the situation is actually, if you ask me to do analysis of our work in the last 1 week or 2 weeks, almost 80% misinformation is about the treatment of the disease. Like, there are a lot of myths, bogus treatments, and how can we fact check that, for example? So we need really domain experts with us saying, oh, this is absolutely not the treatment. Like, you must be seeing in Afghanistan, for example, Pakistan, Bangladesh as well, the number of reports that in the ground of traditional medicine, people are taking extremely harmful, like things as a kind of precautionary measures for the COVID-19, which is certainly not going to work. In fact, they may have long-term health consequences for people. So I think tools are good, strategies are great, but you really need experts here. That means essentially a virologist and epidemiologist here who can help you in the fact checking. And that also includes the claims of research, for example. There are a number of people claiming that we got this drug as a miracle cure and all, but you need, again, people here, top experts here, to say whether this is a drug or not.
That's another question we've gotten. What kind of narratives are we seeing about fake cures, fake herbs? Ahmed, can you talk a little bit about that? What specifically, what kind of false information in terms of treatments and cures you're seeing?
Well, there's a whole lot of false cures ranging from the mystic parts, all these ghostly matters, and also all these herbs and even spices, and even warm water. There's a myth going on that by drinking warm water, you can push down all the viruses into your stomach and you'll be cured of it. So it's very broad, and somehow I think Asians are attracted to all these things, especially in terms of the mysticism. So this is a culture that is very difficult I don't have a solution for it yet, but what we can do is we'll gather all this information about the latest or all these myths about the treatment, and then we forward it to our subject matter experts, for example, our pharmacists. And then we also have links with our scientists who are they are more aware about all these herbs and everything. So we try and use our extensive network to gain as much as we can, so that, because sometimes COVID-19, as I always mention, is something very new. So one day, today, I can say that this treatment doesn't work, but next week, maybe that same treatment may work. So it's very difficult. Usually what we will say is, so far, there's no evidence that it can cure this, but in the future, we don't know, except for the mystic parts.
One thing there's been a lot of talk about is heat, and that's been posited by scientists as well. What effect does heat, humidity have on this disease? What is that doing? What kind of narrative are you both hearing in your parts of the world in terms of that? And is that affecting the response and people's reaction?
I think that one of the key things here is that let's be honest, and I think a lot of health authorities have been honest. We certainly do not know many things about the virus, COVID-19. We have absolutely no idea like how it's behaving right now. We have little data with us to understand. Like first there was a theory that this virus attacks mostly men and not women, for example, when it happened in China. But now it doesn't kill children for that matter. It doesn't kill youth for that matter. But now we're seeing there have been a number of cases of across ages and different profiles of people getting affected and dying actually because of this disease. But this is quite viral. It has been one of the most viral, you can say, posts on social media about if there's a more temperature increases in different parts of Asia, will that be a relief from the COVID-19? And I think that so far the WHO has made it clear that there's no scientific evidence still that because we have seen cases in Singapore where the temperature was plus 38.
Absolutely.
And we are seeing cases in Delhi where the temperature is already 36. So we don't have a research on a number of questions, including whether there's any relationship between the heat and the virus.
Yeah, but is it affecting? Yeah, go ahead, Ahmed.
In Malaysia, I always tell the public that if heat is affecting the spread of the COVID-19, then we won't have any in Malaysia. It's always hot and humid, and the numbers keep on increasing. So it proves itself.
There you go. Exactly. So we've got a question here from Prasanna in Bangalore. She reports for a science, health, and medicine organization and asks, there's much research being published without peer review. Are there any caveats that journalists should follow when reporting on such studies? I'll let either of you or both of you answer that.
Yeah, I think this is really a critical area, and there have been a lot of claims in the last, I think at least 1 month, people saying that this is what we have found, this is what is the solution and all. I think let's be very honest and in analyzing those. If you're a journalist covering the situation, you really need to see what is the data, when was the research conducted, how big was the sample size, have they done something just last week and then came back with the claim. As you are aware, we had a major fraud in India 2 years back. One of the Indian leading newspapers exposed that, which was a fake research factories in India, in a place called Hyderabad, was publishing thousands of fake medical research papers. So we have to be extremely careful of using any medical research unless it has been peer reviewed, unless it has been published in leading global journals and all. Otherwise, the danger here right now is that people really are looking for information. I can just give you one example. We did a math last week about testing facilities in India. Within a 1 week, I think 10 days, it was viewed by more than 2 million people. So that gives us a sense how desperately people are looking for information. So whatever we produce as a journalist, and if you you're covering different aspects of this outbreak, people will actually consume that information. They will take their life and death situation decisions on the basis of that information. So we have to be extremely, extremely careful. Like garlic, for that matter, we have seen in case in Hong Kong, a woman ate 1.5 kg garlic because she thought like it will protect her, and she ended up in a hospital. So we have to be extremely careful when we publish, because there have been cases, at least in India, where a number of unknown doctors have been interviewed by a number of TV channels, and they're coming with a lot of unscientific, thinking, and a lot of bogus statements actually. And so it just does not mean somebody has a designation, is somewhere, posted something, and then he comes with the research and says, oh, this is my solution for this disease. So we have to see what WHO says, for example, or what the leading scientific research bodies are saying.
Yeah, may I add on that? Scientific journals are very difficult to understand. Sometimes you have to understand how much weightage that journal has, how much population samples that they take. So these are very technical issues. Even I sometimes can't understand. But that's why we need, for journalists, I suggest that you reach out to those who are experts in their field. For example, in COVID-19, public health specialists, they would know how to validate the data and also tell you about all these graphs, all these flattening the curves and everything. And also ID physicians or infective disease physicians. So they would know what works, and they would know what they're talking about, as compared to general practitioners. I mean, you wouldn't ask a cardiologist about infectious disease. They wouldn't have the same understanding as an ID physician. So get the right person to speak about that particular topic.
Interestingly, we have a question from a doctor in Delhi right now, Dr. Ashish Pakra, who asks, what can he do? What tools can a doctor or a citizen use to check false information? So any advice you can give to folks who are consumers of this information?
I think we have to be extremely careful about the WhatsApp. So we need to have a little bit understanding about if it is a WhatsApp forward, what does that mean actually to us? And it's just somebody writes, somebody doctor posted at some place and said that. We need to really verify that. So WhatsApp has to be taken care of. Don't forward anything if you feel this is something too good to be true, or this is like a bogus treatment. And if you are in different WhatsApp groups, in your family WhatsApp groups, and you're a doctor, you please debunk that. Tell them this is not true. Please don't forward and circulate this. And as I mentioned earlier, for images, for example, you can use Google reverse image search. You can use Yandex. You can use Baidu for that matter. 10i is a very strong tool. If it is a video which has been uploaded on WhatsApp or Facebook, on YouTube, you can use Data Wrapper from Amnesty International, or you can use InVid. Both are very strong tools to help you to debunk any misleading video.
What advice do you give you have about 200,000 followers, I think, for your group on Facebook, et cetera. What advice do you give them in terms of checking their own information?
For Malaysia specifically, what we after writing all these stories and everything, we will always end with, make sure you get your facts right from 3 sources. One is from the Director General of Health, the Ministry of Health, and also the World Health Organization. That's the best bet of getting the facts right. So for healthcare workers, I would suggest that all misinformation should end with you. When something comes your way, it's you who have to stop. You have to tell your group mates that this is wrong. If you don't know, you use your network, your other colleagues, your doctor friends. I'm sure you have all these other specialists who you know. So you contact them, ask them, verify whether it's true or not. Then the information should end with you. Everyone has a role to play, especially healthcare workers.
Great. We've got a question here from someone in Kashmir in Srinagar, which Syed knows very well. very highly controlled, very hard to get information, very regulated, hard to get accurate numbers and facts, except what the government shares. He says, expert doctors are directed not to speak to the press directly. Low internet speeds also restrict access to authentic medical information, and fake news circulating on social media makes things worse. What's your advice for reporting on COVID-19 in such a scenario?
I think certainly it's a challenging situation in a number of places. As I was saying earlier, in China as well, it was extremely tough for local reporters to report about it because the government was not releasing the data. What I often suggest is like, look at small stories. Don't go for big stories. Just go and meet one person, one patient, and tell his story. Go to visit a hospital and cover that particular hospital. And I'm pretty sure when you start going out, maybe even on a phone, you start speaking to people, and then you can compile as a one big story. But what often happened with the reporters when they cover the big story like the COVID-19 situations is like they're looking for a big stories. But I think the big stories don't happen that way. So you really need to do a lot of small stories in the next couple of 2-3 weeks. And then once things are a little bit better, then you can go and analyze the numbers, look at the different trends and all. I will also suggest look at the historical data, which is already available there. And see, like say for example, in Kashmir, how many ventilators you have in Kashmir. Look at the purchase orders of the government. That data should be in a public order somewhere. Look at how many virologists you have in Kashmir, how many epidemiologists you have, how many hospital beds you have. All this data is publicly available. You can combine all this data and you can map some situation. And you can say, okay, this district, that province, that area will need more attention because they're not having enough doctors there.
Great. And getting interviews, again, interviewing a doctor, they could lose their job. So in terms of collaborating between journalists and doctors, and that's happening in other countries as well, right? Doctors are not allowed to speak out. How should both doctors and journalists operate in that environment?
Ahmad, okay, I'll leave to Ahmad.
Okay, so for us, for Misinformation Malaysia, the main reason why we form an NGO is because we want to be that voice that is impartial, so that we don't always have to listen to whatever the Ministry of Health say. We can choose. We can choose what we want to do. So in other aspects, is we tend to say things that are neutral. So like for certain issues, we try not to be as provocative because I can lose my job as well. And then in that particular group for Medical Mythbusters, we have healthcare workers from the private and also the public sector. So for what we do is, despite having this one big group, our own individuals are also strong personalities. So whenever we can't say something regarding the policy of the Ministry of Health official policies, our colleagues who are in the private sector can say something that can benefit the public and be rather critical towards the ministry. So it's a very difficult position to be in, but we find that this is the best move forward. Because at the same time, we would also like to have that link with the Ministry of Health to get information, to understand their policies, so that whenever we write something that is factual and maybe something that we can look forward to and we can tell the public. So yeah.
If I add one word there, I think it's very critical that you protect your sources, no matter what kind of reporting you're doing. And naturally, in this kind of situation, when a doctor says something, and if you make his name public, he will lose a job because of that. So I think it's extremely important for you, before you interview anyone, you need to take their permission, whether they are on record, whether they want to be named in this story or not. You can't call a doctor and say, this is a story and this is what it is, and then without telling him that you're using his name and all. So that's extremely important. And second is, I think there are a lot of people still, public health advocates, who are keen to come and give you some sense what's happening. You don't need to really interview the doctor who is treating the patient, but there are a lot of other people as well who are willing to speak. And that has been our experience. There have been, I think, hundreds of people writing each day, sharing a lot of critical information with us. And we tell them we will naturally take care of the protection and all.
Great. We had one question, just want to assure people, we had one question about the names of some of the tools you mentioned, Syed. Just so everybody knows, we will do a write-up after this webinar, so we will have all of the names of the tools and links to those, so don't worry about, you'll be able to get those. We've got another question from India, which I think applies to many countries, and they're asking about, they're saying that getting the right data in India is starting to become tricky. The state and the central governments are publishing mismatching numbers, which is a nice way to put it. How do you operate in that environment? And again, we're seeing that in the US, we're seeing that lots of places where you have conflicting numbers. So how do you, as a journalist, and as a misinformation buster, how do you deal with those mismatching numbers?
No, I think it's really critical to see what official numbers are, because that is the base. And then as a journalist, you critically examine those numbers. And say, for example, the government says there are 10 deaths reported in Delhi, Mumbai, or in Singapore for that matter. But then you can also fact check that information by talking to people in different hospitals and facilities actually. And you can do random check, for example. You can go and take picture for that matter, for example. That's what journalists often do actually. So you don't take the state's number as a Bible. Like last week we did a story, for example, why is there a difference between WHO and John Hopkins figures? Like they're both independent, most reputed organizations. What is the problem? So we explain to our viewers what is the problem with those numbers. And numbers are actually the key in this reporting assignments actually, because the numbers tell you the scale, numbers tell you the problem, they will explain the hotspots. So you really, really have to work hard and I will suggest look at a lot of historical data. And the problem, particularly in case of India, is essentially that almost 80% deaths in India are not medically certified deaths. So that's why even in this COVID situation, eventually we may never know how many people will die because of this disease, because we don't have data of medically certified deaths, almost 80%, and that is the official number. The deaths are not recorded in this country. So eventually, maybe my fear is we may never know actually how many people will die because of this disease. But that is, keeping that aside, you can still build a strong story around numbers. And that certainly means that you really need to, if you're a good health reporter, you should know people who will give these numbers to you. Like somebody is asking, I'm checking the chat, somebody is asking about the equipments, for example. So I always tell reporters, you please remember 4 things. People say, why do I get figures about health? So anything which has been purchased by the government, there will be data about that. Like how many ventilators have been purchased? How many hospitals are operating in this state? Because no hospital can operate without a license. So that means some authority has given them a license. So you can go to the licensing authority and ask them how many licenses you have given. Like every doctor gets salary in India. So you can easily figure out from the health ministry how many doctors are available in my province, in my state. This number is public actually. So you can then figure out a map actually, like whether this province or that province has enough number of doctors or not.
And can you find, to that question also asks about health equipment specifically and PPE. Are those numbers public? Is that data publicly available? And do you go to the Ministry of Health? Is that where you start?
That's a very good question, actually. In most of Asian countries, actually, we have met a number of public health authorities. What the good thing here is that almost 11 Asian countries have Right to Information Act, though you can't use that right now, they just defunct because of lockdown. But then every year, every ministry, every department of health gets audited by an independent auditor. And that report is also available in public. Like I remember a story we did a couple of years back about the dysfunctional medical equipment, like X-ray machines not working in hospitals. And we figured out Karnataka, which was India's most advanced state, the 65% or 60% equipment in that state, the medical equipment in hospitals, government hospitals, were dysfunctional. So it's a great story if you map dysfunctional medical equipment in different hospitals in different Asian countries. The Bangladesh, for example, this data is available. Sri Lanka, the data is available because there are auditors who release this report for a public every year.
So that's on a yearly basis. What do you say? We've got a question here from a TV journalist who is dealing with very, very tight deadlines every hour. How do you tell a journalist like that to cover? They're not going to be doing that kind of deep data diving. So what would you suggest?
Yeah, I think they are having the most challenging situation, to be honest, to face it. And I always tell the TV journalists, you have only 2 options actually when you cover any situation like this. That you need to remember that, in journalism, you have only one thing, which is your credibility. And if you lose that credibility by doing something very stupid, you lose it forever. And I can give you hundreds of cases of journalists who have lost careers, who have lost everything in their journalism career just because of one stupid mistake. Because this story is really, really big. It's critical. It's a life and death situation for a lot of people. So if you imagine if you carry a bogus treatment on your live show and say, this is the treatment. Now our channel is the first channel in the world which got this live, this miracle treatment for this disease. And then half an hour later, you figure out this is absolutely stupid. So I think it's extremely challenging situation for those who are live on the camera, and I can certainly understand them, but I think it's extremely important for you that you really have to work hard during early hours in a day to decide what you're going to show in the evening. Because if you decide what you're going to show in the evening, during the evening, you're ending up with a lot of mistakes actually.
Ahmed, what are you seeing in terms of the journalists in your country? How are you finding working with health analytics and with journalists in general? And what value are you as a doctor getting out of this?
Well, so far, I'm actually quite new to this working with journalists. I started in December last year. Everything is very new to me, and I'm quite surprised on the amazing work that all these journalists have done. So far in Malaysia, the journalism is quite, I think it's quite okay. They're getting the right information. They're getting information from the right people, except for the tabloids. So the tabloids tend to get news that are new, that are unverified, but eventually it turns out to be fake. So these are the issues that they are facing. And another one is they tend to get the wrong person to talk about something. For example, they want to talk about COVID-19, they will contact a general practitioner, which might not have the same level of understanding of the disease compared to doctors who are working in the hospital. So the important thing is for them to get the right person to talk about the right thing. So yeah, otherwise, so far I've been having very good experiences with all the journalists I've been working with, and also Health Analytics Asia.
Great. Any final words either of you would like to say? Anything you any message you want to deliver to the journalists listening to this?
I think the COVID-19 is actually the biggest story ever you will cover. So I will suggest put your all resources together, all your contacts together, work a little bit harder this month. But at the end of the day, just protect yourself, because no story is worth a life. A successful journalist is the one who will survive and then tell the story. So because those of you who are photojournalists, video journalists, they're really vulnerable to get this disease because they're going out with their equipment, touching different surfaces and all. So I will suggest do your best, but still make sure that you're protecting yourself or covering the situation.
Great. Ahmed, anything you'd like to say?
So from the medical perspective, I would like to remind all journalists that COVID-19 is a very, very dynamic area. So it changes all the time. From 1 month to the next, information changes. So don't be surprised about U-turns from the WHO or your own governments, because these all are new things for them. Another one is, I agree with Syed, make sure that you take care of your own health. Make sure you handle your hygiene very well. 7 steps of hand washing, make sure you do it very well. Wear mask if you are exposed to all these patients or even healthcare workers. So take care of yourself and make sure you do the right reporting.
Great. Dr. Ahmad Firdaus, Syed Nazakat, thank you both very much for joining us today. We really appreciate it. Thank you to everyone too as well who has listened. This video will be archived and saved. It is on the record, so you can use any of this in your stories, any clips that you would want to use in video or radio. We'll also have a write-up, which will have highlights and quotes you can pull from there, and those tools that have been mentioned here as well will be spelled out, and we'll have links to those as well. So thanks again for joining us. As I said, please, if you're not a member and you're interested, join the Global Health Crisis Reporting Forum we've set up on Facebook, and stay tuned for more webinars coming your way from us and more resources. So thanks again, everybody. Stay safe and stay healthy.
Thank you so much. Thanks a lot, Sharon. Thank you so much.
Thank you. Bye-bye.
Thanks a lot.